Hi, this is Matthias Free for CBI Plus. We're here at the 2013 sessions of the Society for Cardiovascular and Magnetic Resonance. And with me is Dr. Joachim Lotz from the University of Göttingen, radiologist there. Joachim, you just chaired a session here on translational CMR, and you're also following that topic during the sessions here. What do you think are the most interesting areas of research or upcoming clinical applications in this area of translational CMR?
Well, thanks, Matthias, for this question. I think there are quite a big bunch of themes evolving during this SCMR meeting. So one is, of course, real-time imaging, where I myself do some engagement in. But I have seen just in this session some interesting talk about new nanoparticles loaded with gadolinium, and I've seen new approaches to 3D late enhancement. That really impressed me.
Yeah. So first of all, real-time imaging. What are the new developments and how could they be used eventually in clinical scenarios?
Well, I think the big theme about real-time imaging in clinical setting, irrespective of the technique behind, whether it's compressed sensing or radial imaging, is imaging the arrhythmic patient. I think that's a big field where we did not have real progress in the last years, but now we seem to have at least a bunch of 2 or 3 different techniques how to tackle those patients, to make an ejection fraction estimation cleared by the arrhythmics. So that I think is a good thing.
And breathing motion is not a problem, or registration of the images when the patient breathes, and to get a reliable ejection fraction. So you think that's not a big issue?
No, I don't think that is a big issue, because they are so fast, the real-time images, that you can clearly delineate and then via software eliminate the respiration motion.
Okay, yeah. And do you think that may also have implications then for interventional MR down the road?
That's what we all are aiming for, of course, on the right ventricular side, but also on the left ventricular side, because we have seen, especially with the radial real-time imaging approach, we have seen a huge increase in resolution. That was hampering the interventions. So I think that the high-resolution real-time will give us a way to go as interventional radiologists or cardiologists to the heart.
And the other topic you mentioned were loaded nanoparticles. Now, the problem for labeled contrast agents for MR always was sensitivity and the lack of, so a limited number of particles can really get to the. So are there new developments which help to tackle with this limitation?
Well, I think all of the developments still are way beyond or below the clinical application. But what we have just seen is, putting up nanoparticles, putting in a huge amount of gadolinium into the nanoparticles and coating the nanoparticles with specific ligands, and therefore increase, for example, the attachment to albumin or to the vessel wall specificities. So that might be the right way to go.
Yeah. And have there been, or have you observed any, say, potential applications which are a little bit closer to reality than others? So what would be the first, from your point of view, where we could expect something like a phase 1 or 2 clinical trial?
Well, I think what we could expect, as from what my perspective is, we could see first clinical applications in plaque imaging, so differentiation of plaque, of inflammatory plaques, of silent plaques, with the help of specific nanoparticle gadolinium contrast agents.
Okay. And last word, what do you enjoy most at the Society for Cardiovascular MR sessions here? What's the most important thing to you?
Well, I think that too, of course, as always, first of all, meeting the people, getting into talk with people you just know from the papers, and having the ability to see them in person. And the second is, I think the SCMR has a unique culture of discussing, of really interrogating the researchers on a very fair but pregnant way. I think that's very good, and it's outstanding comparison to the other meetings like AJA or on the radiology meetings.
Okay, thank you very much, Joachim. That was Professor Joachim Lotz from Göttingen, Germany. This is Matthias Friedrich for CBI Plus. Thank you.